Well, Pride Month is over, but the fight for equity goes on year-round. And some local providers want to make sure healthcare access is part of that conversation. Studies show LGBTQ people are at much higher risk of suicide, mental health problems, and substance abuse. Hazelden Betty Ford is an addiction treatment organization, and I spoke with the clinical director of its center in Newburgh, Molly Simpson, to get a deeper context for LGBTQ communities.
Have a lot of challenging adverse childhood experiences related to bullying, trauma, and that's really, really impactful later in life.
A national study from Desert Hope showed higher rates of LGBTQ youth starting to use drugs and alcohol and earlier in life, often as coping mechanisms. CDC data show lesbian, gay, and bisexual youth are 5 times more likely to attempt suicide compared to straight youth, and 40% of trans adults have reported suicide attempts. And although we've seen a lot of progress toward acceptance, there are also steps back.
Being actively, I think, traumatized and re-traumatized by, current events right now. We're in a year that's been record-setting in terms of the number of anti-trans bills that are being introduced in states across the country.
LGBTQ people also have less access to care, especially older adults who don't trust the system as much. A survey is still open for older LGBTQ adults in Oregon to help address these kinds of disparities, and you can access it on kgw.com through mid-July.